Okay, let's go to Chris.
Thank you, Madam Chair. House Bill 2729 requires the Oregon Health Authority to establish a minimum grant award for school-based health centers to award grants to school districts or educational service districts for district planning and technical assistance, to develop and award grants for school-based mental health services and substance use prevention, to study reimbursements for mental health services and substance use prevention. The measure authorizes the Oregon Treasurer to issue lottery bonds for this act. The measure appropriates funds from the general fund to OHA to carry out this 2025 act and takes effect on the 91st day following adjournment.
Okay, thank you so much, Chris. So we're switching now into that school-based health center space to have a conversation about all those services. So, and I also have testimony on this one, but I'm going to hear from this wise panel first, and maybe I'll save mine for the very end if we have time, because we have quite a few people here to testify on this bill. So I'll let you choose the order. Welcome to House Education, Senators and Representatives.
Thank you, Chair. So good afternoon, Chair Neron, Vice Chairs McIntyre and Hudson, and the members of the House Education Committee. For the record, my name is Hai Pham, I'm the State Representative for House District 36. And I want to thank you for your time today. As many of you know, I'm a pediatric dentist, and I've dedicated my life to public and community health. And I've spent nearly 2 decades serving vulnerable families and their children in Washington County. And I'm eager to be here with my fellow colleagues and then many of the organizational advocates to help support HB 2729. Oregon schools, families, and students are struggling with the youth mental health crisis, as there has been recent data that shows that 38% of 11th grade students are suffering from depressive symptoms. 41% of SPHC's visits by school-age youth were for behavioral health reasons, and nearly 47% of Oregon kids from age 0 to 17 have had adverse experience of trauma. School-based health centers are a critical community tool that centers youth and supports their health and well-being. Oregon school-based health centers are in schools or non-school grounds and provide medical care, behavioral health services, and often dental services. Many have an existential role in supporting youth by providing these services in existing structures and can effectively close many gaps in our social infrastructure, especially when it comes to access to care, time, and transportation to these services. And it's clear that there is a community need, as OHA's most recent report on SPHCs found that in 2022 to 2023, SPHCs had provided care for nearly 74,000 students, 52 of whom saw primary care, 47 for behavioral health care, and about 1% for dental care. We can work on that, guys. We need to bring that number up. More ceilings. And what was surprising for me was to hear that 65% of school-based health centers are located in primary care health provider shortage areas. We know that some of our most rural communities rely on SPHCs and their nearest clinics. HB 2729 expands these services and supports SPHCs across all of our urban, rural, and frontier counties. By directing OHA to study opportunities for increasing the reimbursements for mental health delivered through school-based health centers, providing mental health and substance use resources for Oregon schools without pulling from the school state fund, 5 planning grants to help develop new school-based health centers and school nurse models to support thousands of students without drawing from the school fund, and base funding inflationary increase of $10,000 for each SPHC with room for 2 more, which has remained static for over a decade despite annual increases to other health supports. So just as students need pencils and papers to learn in the classroom, we need to give these access to kids so they can grow and thrive. So thank you for your time, and urge an aye vote for HB 2729.
Thank you so much.
Chair Neron, Vice Chair Dobson, and Vice Chair McIntyre. For the record, I'm Janine Sollman. I'm the State Senator for Senate District 15, and that includes areas of Forest Grove, Cornelius, Hillsborough, and the Rock Creek area of Washington County. I am proud to be here in support of House Bill 2729 for the school-based health centers. School-based health centers are a vital component of healthcare for students, providing medical care, behavioral health services, and dental care. Specifically in the behavioral health space, we are facing a mental health crisis for our youth in the United States, and our state is no different. It is in desperate need of infrastructure to expand access to care. In 2023, the OHA Ombuds program reported that 1 in 4 youth ages 12 to 17 have experienced a major depressive episode in the past year. This is the second highest rate in the nation. In 22 to 23 school year, 41%, I think it was already said, but it's well worth hearing again, that 41% of the school-based health center visits by students were for mental health reasons. Student mental health care must be addressed with every tool that we have. School-based health centers provide these services to students with accessible staff and services and have a positive impact on the whole school system, and I would also say the community. House Bill 2729 is a positive investment that reduces barriers like cost, accessibility, transportation, and language, things that keep students and families from seeking the healthcare services they need. Access to these critical services means that we can make meaningful progress on learning outcomes, address chronic school absenteeism, and bring trauma-informed services to students and their families. We know that students learn best when their needs are met. So colleagues, I respectfully urge your support of House Bill 2729. Thank you.
Thank you. Good afternoon. Chair Neron, Vice Chair McIntyre, Vice Chair Dobson. I'm Lisa Reynolds, State Senator from Senate District 17. And I'm just going to be super brief. I will just tell you my patients when they're like, oh, I had to go pick up my kid from school and I had to go to the office and then they spend, 7 minutes with you, Dr. Reynolds. And that's true, and they're very meaningful 7 minutes. So I just know we need kids to have better access to care in the situations where they are. We need them to be spending more time in the classroom, and we absolutely need more mental health services to meet kids where they are. And that's why I'm here in support of 2 bills, this being House Bill 2729, as well as earlier House Bill 2577. We need to really be flooding our schools with as much mental health services as we can muster as a state. So thank you so much. It's an honor to be here.
Thank you so much. And committee members, are there any questions for this WISE panel?
Very wise.
All right.
Permission for a selfie.
Yeah, permission granted.
It's hilarious.
All right, thanks so much. And we do have 5 more to testify, so I'll hold my testimony just if there's time. And otherwise, reminder that you can upload written testimony if you have thoughts on this bill but are not here to testify in person. We're going to go next to Mike Anderson or Justin Birmingham. I believe it's Justin who's here.
Good afternoon, Madam Chair, members of the House Education Committee. Can you hear me?
I can hear you great. Just introduce your name for the record and let me know if Mike Anderson is also joining you.
My name is Justin Birmingham, and Mike Anderson is working with a student this afternoon, and so I have the privilege of testifying alone here. I serve as the Senior Director for Partnerships and Development for the Reynolds School District. Reynolds youth hail from over 80 birth countries and speak more than 100 first languages. In doing so, they braid one of the most diverse and beautiful tapestries of community in this great state of Oregon. And I'm here to support House Bill 2729. In 2019, the state legislature allocated capital funds enabling the Reynolds School District to renovate 3 classrooms at Reynolds High School and partner with the Multnomah County Health Department, transforming them into a buzzing hub for student physical, dental, and emotional health. The installation of the school health center also transformed the community at Reynolds High School. The facts are more than 932 unique clients were served last year in the RHS clinic from a school population of just under 2,500. More than 80% of those came from BIPOC communities. 1,484 required vaccines were administered, thereby maintaining student eligibility to attend school. Comparable figures emphasize service delivered in mental health and behavior health, already spoken about this afternoon. Therefore, seeking to avoid repetition from information you've already received, I would like to isolate a separate argument in favor of this bill. As I understand it, Section 1 of HB 2729 addresses the inflationary costs for operating school-based health clinics. From a real dollar standpoint, that might seem like getting less service for more cost and could test the patience of taxpayers and lawmakers alike. As a public school administrator, I take very seriously my responsibility as a steward of the public and philanthropic resources. So when I surveyed Principal Anderson, as well as school social workers, counselors, and other community partners in preparation, nearly all of them highlighted the efficiencies embedded in the collaboration of hosting a health clinic on campus at a high school, as students are ushered from a trusted school-based adult into the warm handoff towards a medical practitioner. It reduces barriers and increases access to care. Moreover, for students experiencing acute or complex medical or behavioral issues, as school and medical staff come together to triage, then share critical care information and collaborate to develop comprehensive treatment plans, it is a far more efficient delivery model than schools and medical clinics working in isolation. It keeps kids in school and reduces medical costs. It centralizes care and capitalizes on collaboration. Therefore, the return of investment to increase investment in school-based health centers represents a net return and prudent stewardship of finite public dollars. I encourage you to vote yes on House Bill 2729. Thank you.
Thank you for your testimony. Committee members, are there any questions for Mr. Birmingham? Representative Ruiz.
Thank you, Madam Chair. And I see him smile because Justin and I go way back. Just wanted to say hi real quick and appreciate your work and your service to the school district.
If that's a question, I'll respond with one in kind, which is thank you for your service to the House Education Committee, our community, and the state at large, Representative Ruiz.
Oh, I'm gonna pull that clip. And play it all the time.
We appreciate you both. Thank you for joining us. We are now going to hear from Kristen Nicolescu. And then Cindy Hernandez.
Cindy won't be here today.
Okay. And then Dee Pressure would be next. All right, welcome, Kristen.
Thank you. Good afternoon, Chair Neron, members of the committee. My name is Kristen Nicolescu. I'm a physician associate in practice for almost 15 years, a medical provider at school-based health centers, and the director of school-based health services for One Community Health, a federally qualified health center in Hood River and the Dalles. After many years working in emergency medicine, my decision to leave the ER and move to school-based care 7 years ago has resulted in the most rewarding and fulfilling years of my career. At the same time, I've come to understand the challenges of working in and operating these small bootstrap clinics on school grounds. Often for underserved, geographically isolated youth in rural communities, school-based health centers are the safety nets and the primary access points to a complicated medical system. Students and their families face barriers such as transportation challenges, financial constraints, and provider shortages when trying to access health care. SBHCs bridge these gaps by delivering care right where the students are at school. To help you understand what is happening on the front lines of school-based health centers, I reflected on and asked my colleagues to tell me about a few of their patient encounters over the last week. What follows are some examples that may seem unremarkable at first, but the extraordinary efforts made by both school-based health center staff and patients tell some truly remarkable stories. This week, a high school senior was cleared to return to sports after injury. This in itself seems pretty mundane, except 3 months ago, this patient sustained life-threatening head and facial injuries from a horse. While they were lucky enough to be discharged from the hospital, stable, a few days later, the discharge plan was less than ideal, without an established primary care physician and no scheduled follow-up with specialists. In the ensuing weeks, the provider at the school-based health center, along with the school nurse, ensured this patient's fragile skull came to no harm through regular follow-up, repeat outpatient imaging, coordinating telehealth appointments, and soliciting specialty consults over the phone. When 3 months ago this patient was millimeters from death, he will start baseball practice later this month. Provider recently received news that a longstanding patient will be graduating this spring. Again, rather unremarkable, except 2 years ago, this Native American patient was brave enough to approach the mobile medical clinic requesting mental health support for depression and anxiety. At that time in the patient's life, when they and their guardian had limited transportation resources and medical access, the services provided on the mobile clinic located on the school parking lot helped to prompt a cascade of events. Mental health supports led to a sports physical, which led to playing basketball, leading to improved motivation in school, a brilliant high school basketball career, and improved mental health and confidence. This patient is now exploring post-secondary school educational opportunities, which is truly remarkable. Finally, as a community, we recently surpassed 12 months without known to me youth suicide in our local area. And although it shouldn't be, this is remarkable. After a series of deaths by suicide of school-aged youth in our region, our school-based mental health team continues to provide in-person grief counseling and treatment for affected students in efforts to reduce suicidal contagion. The process whereby one suicide within a school or geographic area increases the likelihood that others will attempt or die by suicide. These sorts of stories are not only common, but what we have come to expect on a day-to-day basis. I don't have enough time today to tell you about the dozen other examples provided to me, but the diagnosis code list reads something like this: severe depression, chronic, anorexia nervosa, acute on chronic, sexual abuse of a child, post-traumatic stress disorder, chronic, anxiety, chronic, adjustment disorder. I would be remiss if I didn't mention that since starting my work with One Community Health, the ratio of medical to mental health patients has completely inverted. We now see more patients for mental health concerns than for physical. The staggering number of students, even students as young as 7, 8, and 9 years old, experiencing anxiety, depression, and PTSD is alarming. In older kids, the reported incidence of suicidal ideation is staggering. I'm so proud of the remarkable impact we have on patients, but the healthcare needs of our youth have long been outstripping our resources to meet these needs. These types of services are possible because of existing grant funding through the state of Oregon. This funding helps to employ 3 mental health care providers, 3 medical providers, and 4 invaluable support staff positions on roughly $250,000 annually. In addition to brick and mortar services in Hood River and the new clinic in Dufur, we have deployed these staff members to provide telemental health services and have also taken physical health services on the road, as you heard before, with the use of the One Community Health Mobile Health Clinic. These projects span 4 districts, 2 counties, and a range of almost 100 miles. While we are grateful for this funding, it certainly does not cover the full cost of staff FTE, nor the cost of Monday through Friday service provision, let alone the cost of medical supplies, medications, educational materials, equipment, the list goes on. In addition to caring for patients, my role includes finding and securing other grant funding to support our operations. Despite this, our school-based health services still rely on One Community Health's operational budget to remain afloat. By passing House Bill 2729 and increasing funding to the state school-based health centers, Oregon can reaffirm its commitment to the well-being of its youth. Please support this bill for the thousands of students who rely on school-based health services to reach their full potential. Thank you for your time. I welcome your questions.
Thank you so much for your testimony. Are there any questions for Kristen? Thanks for your work.
Yes, you're welcome.
Appreciate you coming today. Next up, do we have Dee Pressure with us?
Dee was unable to make it and is going to submit written testimony.
Okay, wonderful reminder to everyone that you are able to submit written testimony for 48 more hours. And Dee, we look forward to reading yours. And then last up, I have Lane Schaffer. Welcome, Lane.
Hi, good afternoon.
Good afternoon. And just restate your name for the record as you begin. Thank you.
Yep, good afternoon. Good afternoon, Chair Neron, Vice Chairs, and members of the House Committee on Education. My name is Lane Schaefer, and I'm a current student at Willamette University right across the road. Grew up in Portland, went to McDaniel High School. So I have a really deep connection to this bill because McDaniel High School has had a school-based health center for all of the years that I was there, and I was able to utilize it throughout my time there and even when I was in middle school. School-based health centers provide vital mental and physical care, like we've discussed, that is now needed more than ever in the state of Oregon. My colleagues can speak more technically to what exactly health centers provide and how this bill will support that. But I want to focus on what having an SBHC in school means for students, because we've talked a lot about students today. And I know that there were more students that wanted to come and testify because it truly does mean a lot to students to have this service available right in the school. As I said, I utilized the McDaniel High School Health Center. As an athlete, as a wrestler, I needed it for physicals, for skin health checks, for injuries. I utilized it for vaccinations and for mental health services. And I really cannot convey enough the sense of security and safety that these health centers provide in schools. Having staff who are specifically focused on students, who know the communities, and are from the communities where those students are means so much, because it means that they can direct students towards the right resources, towards the right supports if they need to treat something or if they need something like food or clothing. And that's something that is really unique about health centers. It's something that I cherish about health centers, and I know that I used to look forward to my appointments because I had such a good relationship with the people who worked at my health center. It also helps to build trust in the health system in general. I know that that's a really big problem for a lot of students, is that maybe they haven't utilized the health system a whole lot. It builds health literacy, and it builds a habit of preventative care, so that when they go out into the real world and they don't have access to that school-based health center right in the school, they can go and get that. I also want to emphasize the behavioral health services provided at SBHCs, because they were such a crucial part of them, but they were so underfunded that there was often months-long waits to access a health provider. And as a result of that, students just went without care because they needed the care then, and they couldn't wait 6 months for that care. And I know that in McDaniel High School, we had a lot of difficulties with drug use. We had 2 students overdose on fentanyl while I was still at that school, and I know that those were preventable deaths, and I know that there are so many people suffering at high schools and middle schools across Oregon that desperately need these services in their schools, because the barriers of transportation, the barriers of cost are real, and health centers address that both in person and through telehealth, like we've mentioned. I don't have to tell you that students are struggling with mental health, but I think that having these resources within schools, being able to direct students right down to their health center and having that trusted relationship over years is crucial, and it's something that can't be replaced. Thank you.
Thank you so much for your testimony. Committee members, are there any questions for Lane? All right, what an incredible voice for what school-based health centers mean to students. And we do have just a little bit of time, so I'm going to deliver my testimony from the dais here on this topic, and we can have a little bit of wrap-up discussion before we adjourn. So, Vice Chair Dobson, Vice Chair McIntyre, members of the committee, I am Courtney Neron, State Representative for House District 26, and in strong support of House Bill 2729. Similar to the previous bill that we heard today, I believe that we need to be talking about the importance of addressing in robust ways the mental and physical health of our students and families. This is a bill that invests in services and keeps people in school. It will improve educational outcomes and provide access to care and even create jobs. As an educator at Tigard High School, where I worked, we had a school-based health center, and I had many students who utilized the services on site for their health. I think about one student who had an infected finger and who got it bandaged up and returned to class quickly, didn't have to leave school for an appointment off-site. Another student had a swollen knee for weeks and said her mom wouldn't take her to the doctor. I was able to encourage her, and she was able to be seen the first day she asked for an appointment at our school-based health center, and was able to get some answers and some treatment. I myself even ran down to the health center when I had a sore throat one day to ask if they could test and find out if I had strep throat, so was able to get an answer right away as well. At a time when we need to do everything we can to address absenteeism and increase academic outcomes and ensure strong communities, school-based health centers are a critical part of a broader solution. As an educator, I also know the pain of losing students to the school, to mental health challenges, and the school-based health center model is part of an important continuum of care for our communities. Where investments have been made in school-based health services, data shows notable reductions in rates of depressive episodes, and suicide attempts. I urge your support for Oregon school-based health centers and support for this bill, House Bill 2729. Thank you. Committee members, are there any further comments, questions, discussion that we want to put on the record today? All right. Appreciate our robust discussions that we've had. And with that, I will close the hearing on House Bill 2729 and adjourn the committee for the day. Thank you so much.